Welcome to everyone to our conference today. We want to thank our panelists that are here, and we also want to thank our funder, Just Fund Kentucky. We appreciate having the opportunity to provide this conference, and we appreciate the attendance that we've had so far. So our panelists are the folks that I'll introduce next. So Tami Damron is the Associate Executive Director of AVOL, Kentucky. She has a Master of Arts, an MSW in Social Work, and CSW. She received her MA in Sociology from Morehead State University and her MSW from University of Kentucky. She's been a CSW since 2008 and has nearly 20 years of social work experience in the areas of addiction, HIV and AIDS, and housing. She's very passionate about social justice and the intersectionality of gender, sexuality, race, and class. So Tami, thank you so much for being here and participating. Also, we have Katie Sabitus. She has a Master of Science, received her degree in biomedical anthropology at Binghamton University in Binghamton, New York. She spent the entirety of her professional career serving vulnerable populations, including people living with HIV and people who use substances. Katie currently serves as a Ryan White Program Manager at University of Kentucky's Healthcare's Bluegrass Care Clinic. And last but not least, we have Mary Edinger, CSW, who is currently working as a harm reduction supervisor with the UK Harm Reduction Initiative. Her background includes experience working with substance misuse, medication-assisted treatment programs, mental health assessment and treatment, education and outreach within the criminal justice system, HIV testing and AIDS testing and counseling, and lastly, medical case management at UK Bluegrass Care Clinic. So thank you, panelists, for participating in our conference today. I'm going to unshare my screen now and just kind of go over a few rules. So if everyone will make sure to mute yourself, we'd appreciate that. Also, if you are not a panelist, please don't share your screen so we can cut down on bandwidth. If you're not familiar with Teams, just know up at the top, the bar at the top of your screen, you can view the participants, you can chat, you can raise your hand if you have questions. You can, with the three bulleted items, you can check your device and do all kinds of things on that. But also you can share your video and your speaker if you wanted to do that too. So with that being said, I'll go ahead and ask the first question for our panelists. So if they'll show themselves on the screen. And one of the things that I want to say is I'll ask, I have a list of questions that our planning group developed, and we got input from our students to help guide us in those questions. And so, but I wanted to make sure the audience knew if you have questions, raise your hand just throughout the session. I'll answer, I'll follow up and let you ask those questions as, you know, we have breaks and we can insert those questions in. So, okay. And so I see Tami, but I don't see Mary and Katie. Are you showing your screens? Can everyone see them?
Yeah, my video's on.
Okay.
My video is on as well.
Okay, good. Okay, now I can see you. I don't know why I couldn't a second ago. Okay, well, we will start with the first question. It is, what are some of the top health issues for LGBTQ plus individuals? And what I can do is just kind of call on our panelists. We'll take turns as to who goes first. Tami, I'll let you go first.
All right. You know, I think that first is a complicated question because there's a lot of diversity under the LGBTQ umbrella. And certainly each of those letters have their own unique sort of priority health issues that we deal with. I would say in terms of the entire LGBTQ umbrella, some of the common themes we see that are primary health concerns certainly involve mental health issues, depression, anxiety, suicidal ideation. Folks who are under the LGBTQ umbrella have higher rates of suicidal ideation and attempts, so being aware of that. Folks that fall under the umbrella also tend to have higher rates of substance use, which then can lead to other health issues like heart disease and those sorts of things. Also different types of cancers depending on where you fall in the umbrella. I know lesbians in particular can have higher rates of cervical cancer, which one is sometimes because of not getting regular screenings. Lesbians are typically more at risk for breast cancers because of being less likely to have children, also not getting regular screenings, those sorts of issues. Of course, certain types of anal cancers related to HPV, depending on the types of sexual activity people under that umbrella fall under. Of course, for much of the umbrella, HIV is disproportionately affects the community. So there's the risk factor for that. I think one that often gets overlooked for the umbrella is intimate partner violence. We tend to stereotype and think of that as a heterosexual dynamic, a men who abuse women kind of dynamic. But a lot of studies have actually shown that intimate partner violence is more common among same-sex couples. So I don't think that's something that always gets screened for really well among healthcare providers and that community. So those are some of the top ones I would highlight off the top of my head. I think the one addition I think special attention needs to be paid to the T under the LGBTQ umbrella, especially when it comes to healthcare. Reproductive healthcare for that community especially can be problematic. If you're a trans man, you still need gynecological healthcare. But that can often get overlooked. There can be a lot of barriers in finding a gynecologist who's comfortable having a trans man in their office waiting for services, or even a full discussion of, what birth control needs trans men have, what types of screenings do they need, those sorts of things can be really big issues for trans individuals. And with that, I'll turn it over to another panelist.
Okay. Mary, would you like to add anything?
Sure. So I think that one of the things that I saw a lot working as a medical case manager was related to the power of attorney, living will, and consents related to medical treatment. Oftentimes, especially even now, the fact that legal standing within relationships within the LGBTQ population is not always acknowledged and recognized appropriately, and making sure that our patients have their wishes honored, especially when there is a crisis and there's a need for someone to act as power of attorney. A lot of our patients have a significant trauma history, so making sure that you have trauma-informed providers across the spectrum, not just in mental health, but from the moment of scheduling, front desk staff, transport individuals within an agency, and making sure that people are recognized with the appropriate pronouns, making sure that they are that when they sign documents, it's really important, especially again under that T category that Tami mentioned, making sure that if there is a possibility within your electronic health record or within the file to classify someone's gender as a lot of health systems use an X instead of male or female. They use an X if someone identifies in that trans population, just to make sure that they're not alienated from care, and making sure that everything is set up to give them dignity when they come in for care is a huge step towards making sure that there's equitable care and services provided. So, and then I'll let Katie take.
Absolutely. We'll hear from you, Katie.
Sure. So I think that Mary and Tami have hit on a lot of the points that I would have made. But I do think that it's important for us to remember sexually transmitted infections of all kinds when it comes to the LGBT population, not just HIV. We do see a huge disproportionate share of HIV in the LGBT population. But I think that historically, a lot of STI screenings are done based on like heterosexual sex. So if you're not having sex in a way that would catch an STI in urine, then we won't identify an STI for you. So I think just offering like different kinds of swabs for people who might have sex in a different way is really important so that we are catching all of the infections and making sure that you're being treated in a way that actually meets your situation, your needs. Piggybacking off of what Mary said, I think being called by the appropriate pronouns is incredibly important, and just having folks be able to check off boxes on forms that they really feel like they identify with, so they feel like they are like engaged in their care and that they are recognized from the time that they check in at the front desk. I think that that is incredibly important. Too many options on a form is really a good thing for us. I want people to be able to tell us how they identify, to tell us what they do, and to have their behaviors feel normalized.
Thank you. We have a question. Monique, would you like to ask yours? Or would you prefer I ask for you? So I'll go ahead, because she may or may not have access to speak based on her microphone. But her question was, how do you deal with those who actively are against the LGBTQ plus community being involved with the church? And we have a whole session that's going on now on faith and religion, but we would like to hear your input as well. And we'll start backwards this time. Katie.
Can you ask the question again?
Yes.
I think I missed part of it.
So the question is, how do you deal with those who are actively against the LGBTQ plus community being involved with the church?
Being involved with the church.
Right. And so obviously that's not a question related to the medical community.
Sure.
And we do, just FYI, we do have a session on health and wellness that's going on right now too, if anyone wants to attend that. But I'm not sure if anyone in this particular group, whether it's Katie, Mary, and or Tami, wanted to speak to that.
I think that I would just say that we understand that people have their own opinions, but we do require mutual respect within our clinical spaces. I would step in, any member of our team would step in if there was discrimination happening in our lobby or in any of our spaces. I'm not sure that I'm answering your question properly, but we absolutely do require respect and compassion amongst all of our patients in our spaces.
Okay, thank you. If no one else has anything to add to that, my next question for our panelists is, why is it so important to be out with your healthcare provider? And we'll start with Mary on this one.
So it's really important to have that relationship with your provider if you feel safe, and if that we don't want to cause further trauma. But if your provider knows about your lifestyle, your living situation, your sexual activity, they are better able to tailor care to suit your needs. We want people to receive individualized care that is specialized for them. We can't say that if you fit in this box, or if you are of this gender or of this, racial or socioeconomic status, that these things are the only things that affect your health. Part of your sexual orientation and how your community is identified, and part of that is the trauma-informed care, because unfortunately, a vast majority of the LGBTQ population has at some point in their lives experienced trauma, whether that's from the medical community, from their personal experience, from their families, from their friends, employers. And it's critical that we are sensitive to that and that we provide care that acknowledges that experience. And we find that health outcomes are going to be vastly improved if you're tailoring care specifically for a person's needs, rather than providing it more on a general spectrum of care, because that spectrum is very wide in a lot of areas, and it's just not possible to tailor care and individualize it in a way that is sensitive if you aren't aware of what a person's needs are, in my experience.
Thank you. Tami?
Yeah, to continue, certainly, I think for a successful healthcare relationship between a patient and a provider, you need to be able to talk about sensitive things. And I think that's especially true. And, I can also speak to that as a person under the LGBTQ umbrella, that when I am upfront about this is my identity, these are the behaviors I engage in, I get much better answers to questions I may have about that healthcare need, or even on issues that, maybe generally my provider would be like, oh, you could wait on this or whatever, but then I can explain, because of my identity and because of my relationship status and that sort of thing, this is important to me now, and I need something done about it now. I've had much better outcomes by being out and upfront. It can also be useful, and this bleeds over into the next question will be on the session too, of, when I'm looking for a new provider, sometimes I'll just make a call and be like, hey, is your office comfortable with serving LGBTQ patients? Do you have other LGBTQ patients? Because it isn't always just the provider, but just the office you're walking into. I've had good relationships with providers, but I, might get repeatedly misgendered by the front desk, staff. So I think it allows you to advocate for yourself more as well, by being out and upfront about who you are and what your needs are.
Okay. We need to pause just a moment for an interpreter break. So I'll let Dana and Aaron do that. Okay. And so, Katie, do you have anything to add to that?
Sure. I think Mary and Tami said a lot of what I would say, again, on this question. But when it comes to HIV and other STIs, which is really what a lot of my experience has been, most of the treatment and prevention are based on risk behavior. So if we don't know what kind of risk behaviors they're engaging in, we might not know the best kind of treatment or prevention to suggest. So for example, if we suggest an external condom and that is not something that fits your sexual preference or your sexual behaviors, then that prevention method will not be useful to you. So I do think that it is incredibly important, like Mary said, if you are comfortable to share what your practices and behaviors are with your healthcare provider. It is incredibly beneficial from a treatment and prevention perspective for us to know what is going on.
Thank you.
Thank you.
And so that leads to our next question of how can I find an LGBTQ plus friendly healthcare provider? And Katie, if you want to continue since you're on screen.
Sure. I mean, all of our providers at the Bluegrass Care Clinic are very comfortable serving the LGBTQ community. But I do think that word of mouth works really well for us. I would say if you have another friend that you are close with who knows about your identity and who shares a similar identity or experience, I would say ask them what their experience has been. Ask them what providers they felt comfortable with, what providers have made them feel like they are heard and included in their care and decision making. I think that's a way that we've gained such a good reputation, is word of mouth. I know that folks in the LGBT community can be pretty highly stigmatized, but once somebody comes and has a good experience, they tend to share that with their friends, and that makes me very happy. I do think that word of mouth is incredibly important, and I think you can find a lot on the internet these days too. There's a lot of like forums and panels about LGBT healthcare, and I'm sure that the internet could provide you some very good information as well.
Thank you. We'll go back to Tami.
Yeah, I certainly agree. I think the best way to provide find a sensitive provider is through word of mouth. And I think one reason for that as well is because you get actual anecdotal experiences of this is what my actual experience was from friends. I think the other thing, there are tons of online directories where people can sort of advertise as LGBTQ friendly providers. And that sort of thing. I think one of the reasons word of mouth works better is there are sensitive and good providers who don't necessarily advertise specifically to the LGBTQ community. I think that's especially true in more rural areas. And I think that word of mouth of like, hey, if you have someone else under the LGBTQ umbrella that it's like, hey, who do you see? What's your experience like? That can be really useful. I think outside of that, you also have folks who maybe you're new to a community and looking for a provider and you don't have like someone I think another really good option is if you're connected to any LGBT groups in social media that are local, being like, hey, I'm new to town. Can anybody point me in the direction of an LGBTQ friendly provider? And I think that can be a really good way to also get some of those firsthand experiences and get connected with someone if you're new to an area.
Thank you. Mary, did you have anything you wanted to add to that?
I did want to say there are one of the places that I've directed folks to if they are moving to a new area and they're not sure and they don't necessarily have a new support system or a new group in the area. There is a gay and lesbian medical association, and they have a provider directory, and that's not going to be as necessarily as good because it is something that people have to register through. But you would at least hope that if someone took the effort and took the steps in registering for this specific directory, that they were at least attempting to provide appropriate care and they were interested in providing care to the population. So if you are entering into a community where you don't know anyone, you haven't found a group yet, a core group, and you're not sure who to trust, that would be a really good place to at least start exploring options. And you could start out by having a phone call. There are several guides out there that you can find online talking about how to call the office. You can ask them if they, have gender neutral bathrooms, if they have providers. Sometimes your front desk staff and the scheduling staff are going to be a great asset to you. You can say, this is my situation. I'm new to town. Who is the best provider in your clinic that would be a good fit to provide services to me? And, hopefully they would lead you in the right direction, or at least if they don't respond in a way that is culturally appropriate for what you're asking, you would know that maybe that's an office I need to avoid, and they're not going to be where I really want to proceed with care. That could kind of limit the amount of additional trauma that someone would face going into a medical visit if they know from the get-go that an office is not necessarily good, or that they have a really great experience and that the front desk person is very open and uses the appropriate pronouns and acknowledges that and says, oh, yes, and they go forward gushing about a certain provider that would suit their needs, then, that's going to lead to a little bit better comfort level when they go to engage in care with a new provider.
Thank you. The next question is related to what is being done in our area to improve health care for LGBTQ plus individuals. And we'll start with you again, Mary.
So just regionally in our area and kind of in the state, we know that there are a lot of education opportunities. The AIDS Education Training Center at UK does a lot to try to make sure that there are opportunities for providers to learn about providing appropriate care within the LGBTQ population. And then I think that there has also been a pretty significant shift in a grassroots organizational effort and just push from within the LGBTQ community to say, this is something we need, and this is something that we have a right to, and we want that. And that word of mouth is powerful. There are more and more people that are willing to, publicly say, I had a very poor experience at this clinic, and you don't want to go there, or you don't want to interact with this person. And so when, in my experience, sometimes providers are taking that information and choosing to change the way that they practice. And I think that that is absolutely what we need to do. There is currently a bill that is trying to work its way through the legislature here in Kentucky to ban conversion therapy, which is basically every medical group or coalition, social workers, nurses, doctors, pharmacists, all agree that that's not a therapeutically appropriate method of treatment. So I think that there are some things that are going on to try to make sure that previously harmful and traumatizing forms of care are no longer going to be accepted in our state and in our communities. And so I think that that is absolutely long overdue, and we hope that it will proceed accordingly.
Katie, would you like to add anything?
Sure. I think at the Bluegrass Care Clinic in particular, we have a very large multidisciplinary care team that serves our patient population. And when we make big decisions, we tend to make them as a group. We have folks on our staff, on our teams that identify as members of the LGBT community, and they bring that perspective to the table for decision making. So we do try to ensure that all of our decisions are agreed upon by a group of diverse folks with different opinions and different experiences in order to be as accommodating as we possibly can. In addition to the multidisciplinary making the decisions, we do incorporate a lot of patient feedback into our care and treatment. So we do patient satisfaction surveys, we do focus groups, we do panel discussions. We want to make sure that folks who are treated at our clinic feel like they are involved in the decision making and are involved in the process development so that they are cared for in the best way possible. We have brought on several staff in the pretty recent past that have made our support groups a lot more robust. I do anticipate in the near future we will be able to offer an LGBT support group for the patients that attend our clinic. I'm very excited about that, and I think that we have some facilitators, moderators that are very, very experienced and excited about getting that group off the ground. I think piggybacking off what Mary said about training, we are going through a trauma-informed care training, trying to make sure that all of our providers and all of our staff that interact with patients and those that don't are trained to be sensitive and to be like culturally aware of folks that might be different than them. And I think just to kind of close my comment, we also have some targeted interventions that we use amongst our patients who are at highest risk. So for example, young males of color, young gay males of color tend to be at highest risk for HIV transmission. So we do have our health educators and some of our other direct patient care staff work with those folks who are at highest risk to talk about prevention and transmission risk reduction.
Tami, do you have any additional insight?
Always. To connect to something, you know, Mary said of the community advocating for itself. None of the changes we're talking about would be happening if the community wasn't and hadn't been advocating for itself for years and years. You know, I think HIV/AIDS was a big part of that, actually, in starting that equitable access to care and culturally competent care for people who fall under the LGBTQ umbrella. You know, I will say I don't know a single person who falls under that umbrella who hasn't had at least one negative experience interfacing with healthcare. Most of us have more than one. And you know, and I think as we've moved forward, it's a population that's become more visible and more outspoken. The community itself has refused to accept subpar care. And I think that word of mouth aspect, all of that comes into that. And I think because of that community advocacy, I think that has a direct through line from the early days of HIV/AIDS and the treatment that especially gay men received. We now have, you know, you can go to the SAMHSA website, the federal, you know, the National Institute for Health, and they now have guides on like, these are issues in healthcare that you should focus on with your LGBTQ patients, terminology primers, you know, how to be culturally competent. So we see a lot more training opportunities for existing providers. I think cultural competency related to the LGBTQ community is much more integrated now into educational programs. So like if you're a nursing student or if you're in med school, you're probably going to have at least some focus on competently serving that community at some point during your educational training, which is something 10, 20 years ago you just didn't see in a wide scale way. And again, that comes from a community becoming more visible and saying, we have specific needs. We need the same care and options that the rest of the community gets. So I think you can't separate that sort of activism from the changes we're seeing now. So.
Okay. So I've had a question. Someone texted to me related to the health disparities, and all of you have mentioned health disparities in the LGBTQ plus populations, but how to address them on an individual basis to decrease the potential for any health problems being any health problems that I may have, for example. And Katie, we ended with you, so we'll start with you again.
Can you read me the question again? I'm sorry.
It was texted to me, and all the details aren't here, but basically it was regarding health disparities. So you guys have mentioned several different health disparities that are out there, but how an individual can address them to ensure or to decrease the chances that this won't be a problem that they have. So, what behaviors, I guess, that they could focus on to be healthier.
Sure. So are we talking about like being proactive in your healthcare and using?
Absolutely. I think that's the gist of it. Mm-hmm.
Great. Yeah. So I think that from my perspective in HIV care and prevention of other sexually transmitted infections, I think when we talk about prevention, a lot of times we're talking about PrEP. So PrEP is a medication that you can take once a day, every day, to prevent the transmission of HIV. So we do have a PrEP program at the Bluegrass Care Clinic that patients are more than welcome to self-refer to, and we can get you into care for prevention of HIV. I do have contact information that I am more than willing to share with Rebecca after this meeting. If you would like to share that with the attendees, Rebecca, that would be totally fine.
Absolutely.
Great.
Or you can put it in the chat too when you're finished speaking. So either.
Yeah, sure. I'm sorry that a lot of my responses are geared toward HIV and STIs. That's just sort of my experience in my wheelhouse. But I would say engaging in prevention methods for sexually transmitted infections and just being involved in routine screenings for your sexual health care would be a really good place to start.
Okay, Mary, do you want to address that?
Sure. So I think that one of the biggest things as far as health disparities, and Tami actually spoke about this earlier, is that a lot of the folks that have had a traumatic experience in the medical field, which, as was mentioned, is a vast majority of the LGBTQ population, is avoidance of certain screenings, especially screenings that require very intimate contact. So any kind of screening from gynecological perspective, prostate perspective, breast exams, those types of screenings are going to be at the highest risk for being avoided or being, delayed. And so anything that you can do as a support for someone or as an advocate for yourself, if you're a part of the community, to ensure that you get those screenings on time every time. And that's so important because the prevalence of certain cancers, as Tami had mentioned, and things of that nature being missed within this population can be devastating. And it's not something that has to be, because as with so many things in health, early detection is key. And so anytime that you can make sure that you're getting into a provider to be seen for those annual screenings or, semi-annual screenings is going to be it's going to really help to cut down on those health disparities. And then also advocating for yourselves, which the LGBTQ population is amazing at doing sometimes, but also acknowledging where you don't feel comfortable and bringing an advocate with you. I know that even in the times of COVID, that there are ways to have someone be with you at an appointment. If they can't be there in person, being there on the phone, being there via Zoom or Teams or something to help make sure that your questions are answered, and having a list that you've thought of ahead of time about things that you want to discuss with your provider to make sure. And, I'm sure that Tami has a whole lot of things to say about this. So I am going to kick it right over and let Tami share from a personal and professional standpoint further.
So yeah, I certainly think self-advocacy is a big part of it. I know I've had to do that a lot through my adult life. I think that the other side too is focusing on mental health care. Um, because of stigma and homophobia, um, again, there's no one under the LGBTQ umbrella that doesn't have some level of trauma associated with their identity. Fortunately, we're seeing less of that, I think, with younger folks and that sort of thing. But it's still a problem that exists. And a lot of those health disparities we see can ultimately be tied back to that stigma and societal rejection, when it comes to depression and anxiety, substance misuse, all of those or higher rates of alcoholism, those sorts of things. We self-medicate that trauma and often don't even frame it as trauma in our own minds. And I think exploring that with a sensitive and culturally competent mental health care professional can help with all of the other physical health issues that can get wrapped up into that. Because like LGBTQ status is an identity status that you may be disowned and rejected from your own family. You may be kicked out of your church, and someone mentioned church earlier. All of those things that most other marginalized communities can sort of hold on to for social support and well-being are often what LGBTQ folks are denied access to. And I mean, just the trauma of that. And again, if you don't address some of that trauma, it becomes really difficult, if not impossible, to advocate for yourself on issues that you should. Instead, you disengage, you don't get your regular screenings for people, especially under the trans community, and body dysmorphia can be a huge issue. So definitely for gender nonconforming folks, any health screening that involves secondary sexual characteristics can be highly traumatic and avoidable. So, and I think whether you're an ally, whether you're a part of the umbrella, I think having these conversations with people within the community as well, because sometimes we're just very isolated in this, and until you're talking to friends about it or talking to someone, you don't realize, oh, that's not like that should be addressed in a health screening. Like maybe talk to your doctor about it. Like this is how you can talk to I've had conversations with friends about that. It's like this is how you can address it to bring it up. And if that provider just glazes over, we'll find you a new provider. And that's the other thing I think to remember too. If you're not getting what you need from a provider, there's plenty of them. So you don't have to remain loyal to a provider who's not meeting your needs, or just isn't not. A lot of times something that LGBTQ folks find as well is you go into a provider and you're more knowledgeable about certain aspects of your health and healthcare needs than that provider is. And that doesn't foster trust in the care you're getting either. So I think finding someone who can address those needs, and like I said, dealing with the underlying mental health needs that can lead to so many of the health disparities because of discrimination and stigma are extremely vital in overall well-being for LGBTQ folks.
Thank you. We have a question. Mary Jones, would you want to unmute yourself and ask the question, or?
Yes. Can you all hear me? Hopefully,
Yes.
hear me. Hi, I'm the coordinator of the dental hygiene program here at BCTC, and actually, we had a group of students do a research project this year about how we can serve this community better. And one of the issues was our charting and our medical history forms and things that we have. The software we use is only giving the choice of male or female, and so I know that's one thing I need to do is research better, see if there's updates on that. But do you all have any suggestions as far as how dental situations, as far as forms and just anything better, resources that are out there that I could access to help our situation here at the clinic, just anything that we can do to make our patients more comfortable.
I'm not sure if Mary or Katie want to address that. Any suggestions?
I think from my experience, using person-first language in your materials is always really important. So saying like people who identify as blank rather than saying like gay people or LGBT people. They're people first before they're anything else. So in developing your forms and materials, I would make sure that you use that kind of language. I would also make sure that like if you have brochures or something that you give out, that you don't just tailor your brochure to one type of person. If there are brochures available that, even if the covers look different, I think people tend to utilize materials that look like them or that they can identify with. So that would be a suggestion. That would be another suggestion that I would have. Mary, do you have any other suggestions?
Yes. So one of the things that I've dealt with before is that you sometimes don't always have the option to change things in your software. And so there are ways that you can find workarounds. So if your software only allows, you to choose male or female as gender and doesn't allow for you to have something else if there's a note section, or if there's a way to put an alert up. The same thing with, sometimes I know that medical offices have to keep the legal name on the insurance as a part of the medical record, because otherwise when they go to bill for services to the insurance, if they use a different name, it can be rejected because it doesn't match up with what the insurance is registered as. And so if we had someone that went by a different name than what was on their insurance card, we would put an alert in the system to make sure that anytime someone was registering that individual, it would pop up, or anytime they interfaced with that individual, it would pop up with their preferred pronoun, their preferred name that they used, so that they wouldn't use inappropriate verbiage when they were interacting with a patient. And then just kind of one of the things that Katie said earlier, it's better to have too many options. And I don't know that you can ever have too many options on a form. So really exhaust things, open things up, and make sure that everything is completely normalized and you don't have a whole bunch of sections where people are having to choose other or NA because the things that apply to their life are not listed, because that's a really big way to feel alienated if you go and look at that form after you finished it and everything that you have checked is NA, or you have to write over to the side because there's not an option to put what is reflective of your life. So that would be good. And then I'm sure Tami has a lot of experience with lots of these forms.
And we have about a minute left, so yes.
Okay, so
Go ahead.
So real quickly, two things. There are lots of great online resources for culturally sensitive forms related to LGBTQ issues. The Gay and Lesbian Medical Association website that Mary mentioned earlier is one good place. GLSEN, the Gay and Lesbian something Education Network. I don't remember what the S stands for right now, but the Human Rights Campaign. There are lots of LGBT sites that have that you can get them pointed to resources. And with software packages, it never hurts to ask the provider of your software if they could make changes. I know I've done that before with systems I've used, to be like, hey, can we add these categories? Because sometimes that's a simple fix. It's just something they haven't thought of or no one's asked them to do. So.
Okay.
Thank you all very much.
I want to say thank you to all of our panelists. You guys have been so informative, and we appreciate the information that you've shared with us. Two things I wanted to let everybody know: there's an evaluation form in the chat, so please fill that out for us and provide feedback for future conferences. Additionally, stick around if you like. We have our drag queen story hour at noon. So thank you guys again. We appreciate our panelists, and again, appreciate all those attending.